Hi, this is Eliminating Measles in South Africa. You can see on this slide the South Africa demographics in 2015 with a population of close to 55 million, and you can see the percentages of Black, African, white, colored, Indian, or Asian. In 2015, over half of South Africa's population, 55.5%, lived in poverty, and 66.8% of children lived in poverty. Looking at the map, the Eastern Cape had the highest rate of poverty at 72.9%, and the Gauteng province had the lowest at 33.3%. And poverty is a key development challenge in South Africa. In post-apartheid South Africa, fighting the legacy of poverty and underdevelopment has been a central theme of the government. And also in the past 10 years, from 2008 to 2018, the unemployment rate has increased from 21.5% to almost 28%. There still remain significant disparities in poverty levels between population groups, 93% among Blacks versus the 1% among whites. You can see the life expectancy on the slide is estimated at 59.1 for males and 63.1 for females, and the infant mortality rate is about 34.4 per 1,000 live births. The South Africa health system consists of the public sector, which is run by the government, and the private sector. South Africa's constitution guarantees every citizen access to health services. So everyone can access both public and private health services. It's just depending on an individual's ability to pay. The majority of South Africans, at 84%, access health services through the government-run public clinics and hospitals versus the private sector, which serves 16%. The National Health Insurance, which is NHI, is designed so that every South African will have the right to access comprehensive healthcare services. It's being implemented. It started in 2012, and it's going to be implemented in phases over a 14-year period. It will be established through the creation of a single fund that will buy services on behalf of the entire population. The funding for the NHI will be through a combination of various mandatory prepayment sources, primarily based on general taxes. Measles is a highly contagious virus. It's spread by contact with an infected person through coughing and sneezing. When one person has measles, 90% of the people they come into close contact with will be infected if they have not been vaccinated or have previously contracted the disease. Measles is so contagious that proportions of the population vaccinated must be about 90% to stop the spread of the virus, and that's to achieve that herd immunity. Looking at the slide, you can see that measles is a leading cause of vaccine-preventable deaths in Africa. And a substantial number can also suffer serious complications, including brain damage, blindness, loss of hearing, and nerve damage. In 1990, fewer than half of the 1-year-olds in 15 African countries were immunized against measles. And in 1996, the 7 countries in Southern Africa had a total of 60,000 cases of measles and 166 measles deaths. To embark on an elimination strategy, South Africa, along with neighboring countries, put in place a measles initiative called Catch Up, Keep Up, Follow Up. First, the country started with Catch Up campaign to deliver the measles vaccines to children 9 months to 14 years. South Africa used its ongoing series of polio national immunization days to deliver the measles vaccine. They set up a Keep Up campaign to continue routine immunizations for babies at 9 months, and they initiated a follow-up campaign every 3 to 4 years. The World Health Organization came and trained key surveillance staff who developed specific measles surveillance guidelines and improved laboratory facilities to suspect cases and be confirmed quickly. Some parents refused to allow their children to be immunized on religious grounds, so the immunization program hired a private sector marketing company that used roadshows to communicate the benefits of measles vaccines. They also recruited community volunteers from the community and trained them to educate caretakers, which were mostly mothers, about the importance of routine immunizations. Volunteers also reached families going door to door to visit to document eligible children. In South Africa, they introduced a public health statute to discourage the religious refusal of vaccinations. And so you can see from 1996 to 2000, the Measles Initiative campaign reached close to 24 million children in Southern Africa and averaged 91% across those 7 countries. The South African government funded its own measles initiative. It's roughly estimated to cost $1.10 per immunized child. The government was convinced to support the strategy and to continue to support it because the measles vaccination is highly cost effective. The cost of increasing routine coverage from 50 to 80% has been estimated at around $2.50 per year of healthy life gained. And so putting that in context, according to the World Bank, interventions that cost less than the gross national income per capita for each year of healthy life gained are considered to be cost effective. And South Africa has a gross national income of $1,000 per capita. By 2000, the number of confirmed cases in Southern Africa was 117, which is down from 60,000, and there was no measles deaths. And 2 South African hospitals recorded a 96% reduction in cases and a 100% reduction in deaths. And there was an estimated about 170,000 measles deaths were averted between 1996 and 2002 in all those countries in Southern Africa. And these are the references I used for this, for measles, eliminating measles in South Africa.